Hi, I'm Rachel Manning. This is my research proposal on the association between marijuana use and depression. Here we go. So the definitions of key concepts in my research is the effects on marijuana, which is that marijuana can impair judgment, increase dopamine release, increase or decrease anxiety, glaucoma relief, red eyes, accelerated heartbeat, stimulated appetite, pain relief, small possibility for withdrawal symptoms, memory problems, lung irritation, increased risk of lung cancer, weakened immune system, slowed reaction time, etc. These are just some of the many effects. Also, marijuana is cannabis, a psychoactive drug. And then we define depression, which is also called major depressive disorder, which includes feelings of sadness, loss of interest in activities once enjoyed, trouble sleeping or sleeping too much, loss of energy, feeling worthless or guilty, difficult thinking or concentration or making decisions, and thoughts of death or suicide. Some causes of depression include abuse, certain medications, conflict, death or loss, genetics, major events, serious illness, or substance abuse. My research question is, can using marijuana cause depression? And many researchers argue that the use of depression can help depressive disorders, while others argue that marijuana can lead to developing depression. So this is why it's important to study this topic, because of the increased advocacy and acceptance around marijuana in society and law today, especially in the state of Massachusetts. It's important to research this topic to find out the truth and potential dangers or potential benefits of using marijuana, and also to warn or inform the public to help provide data and knowledge for public health officials and society in general. So my main findings for my research were in Study 1 and Study 3. They both found a positive association between marijuana use and depression. So they indicated that the use of marijuana will induce later depression. In contrast, Study 2 found almost an opposite result, suggesting that adults do not increase their risk of depression by using marijuana, and those that use once per week or less had less depressive thoughts and had a positive effect on them. So, after evaluating the validities of each study, we found that in Study 1, the Cronbach's alpha for the relationship between marijuana and depression was 0.89, which is a strong correlation, which indicates a good internal reliability and construct validity. The study only accounted for men for a certain age group, therefore the results of the study may not be generalized to a whole population, indicating a low external validity. And in Study 2, there was no Cronbach's alpha presented, so that indicated to me that it was a weak construct validity, although it represented populations with different groups of people, indicating high external validity. In Study 3, they presented high confidence levels for marijuana users developing depression and high confidence levels for heavy marijuana users developing depression, which indicated a strong construct validity. And the results can be generalized to a wider population, indicating that they have a high external validity. So my method proposal is that for my participants, my sample size would be 1,000, because I think that that's a good representation of the entire population. And my sampling method would be stratified sampling, so we could categorize people into different subgroups and get a more reliable answer. So my groups would include men, women, or boys and girls, teens, adults, 16 years or older, frequent users, non-users, and sometimes users, just to get a wider group of people. So for my first measure, I would recommend categorical scale of measurement. So participants would indicate through a survey where they would report themselves, their gender, their age, how often, if ever, do they use marijuana. And after these participants categorize themselves through self-report, the participants will be divided into groups which researchers will compare. Then we have an interval scale of measurement where participants will report themselves of their levels of depression and their frequency of marijuana use, if ever. And they will answer these questions on their level of agreement on their levels of depression or happiness before and after using marijuana. So my procedure would be, first, participants are chosen through stratified sampling and divided into stratas after taking a self-report survey that will categorize them into subgroups: adults, teens, men, women, boys, girls, and their frequency of use. Participants will report via self-report surveys their levels of depression before and after using and their frequency of use. Then the data will be compared between these subgroups. After a year or so, ask the same participants to take the survey again, so we get the retest reliability, and also indicate whether they use marijuana more frequently, less frequently, or not at all, and then compare the results, which none of my studies did. And those are my references. Thank you. How do I get out of this? Ooh. I'm having technical difficulties. There we go.